Osteoporotic compression fractures. Obviously, these are the fractures that are caused by the osteoporosis. So, in case of the osteoporosis, we have very specific problems. Yes, generally, the osteoporosis is far common in women, especially older, fragile, thin women. But it's not only this case. Yes, we can have the osteoporosis after the steroid therapy, sometimes after heparin therapy, prolonged heparin therapy. Benign osteoporotic compression fractures are not always related to specific trauma. It can be persistent with acute onset debilitating back pain. So why this is important that this is the osteoporosis? Yes, because this is a fracture that can happen without any trauma. Yes, so we are just standing up and we get a fracture, yes, of our back. It can be extremely painful. It can compress the spinal cord. It can compress the nerves around. So it is very problematic, and it is very common in the older population. So most of those fractures are in the mid-thoracic spine and upper lumbar spine, most often affecting the vertebral bodies with the most axial load. Yes, so of course, with the most axial load, because there is the most weight, the most force applied to this area. The vertebral body height decreases. Yes, so it's quite obvious. Yes, we have strong ligaments around. So when the vertebral body gets fractured, it behaves like the sack of rocks. Yes, the ligaments usually holds, but the vertebra inside does not have any any structure. Yes, it's just like a sack with rocks. So it just gets where the ligaments allows it to go. So obviously it will have a reduced height and will go more to the sides, generally speaking. The amount of decreasing vertebral body height varies from very mild, just along the end, to severe. And regardless of the height loss, an acute compression fracture can cause significant pain to the patient, which is quite obvious. And although acute compression fractures can be associated with paravertebral hematomas that can mimic a mass, benign compression fractures are not associated with the structure epidural or paravertebral masses. What do we mean? That if you have the pathology, what we are afraid here, we are also afraid about the cancer. Yes, because the cancer can also lead to some pathological fractures, and if there is a cancer, there is quite frequently some pathological mass around. And the hematoma itself can be dangerous, because hematoma is the blood. Yes, the blood can compress the blood under some pressure, and it can compress the structures around, structures like other vessels, and the structure like the spinal cord. In case how to deal with it? Yes, we can deal with it with the surgery. So add some cement, add some nails into the vertebral column, stabilize it somehow, and it can help, generally speaking, but not always. Okay, thank you very much.